Hi, welcome back. The power of photography. It turns out that one of the weapons of influence is social proof, meaning people are driven by what other people are doing. Oftentimes, the shoes you wear are based on what a celebrity is wearing or what you see in Vogue or a fashion magazine. It's why people buy Chanel bags or those red-bottom shoes. It's social proof. And that's why whether it is Subway or Jenny Craig or Nutrisystem, weight loss, they're always looking for celebrity endorsements because people are driven by what other people are doing. That's why when you take photos of happy patients, what ends up happening is it helps other patients, potential patients, become more interested when they see your results. There's a one-to-one relationship. When I go inside the most successful practices in America, there's no doubt about it. The most successful practices, the busiest practices, the practices that are helping the most patients are those practices where they make photos and taking photos of before and after photos of patients a part of their everyday way of doing business. It seems that the guy that has 50 or 100 before and after photos, he's been in business for 10 or 15 years, does better than the person with only about 8 photos. I hear this all the time. Randy, I'm just not that good at getting photos. I also hear, Randy, they come into my studio to tape a production for TV and they'll say, Randy, you don't know Denver, Colorado. They don't like to take photos. They don't want to be on the internet. They don't want to be on social media. But in the same exact town, another doctor, like a Dr. Brown, he buys a practice, 30 years in business. He says they have 0 photos. The only photos they have are those ugly retracted view photos of the inside of somebody's mouth, which us lay people, we're not used to looking at something like that. Even the most beautiful dentistry, a retracted view does not look pretty. And he said, Red, when I bought the practice, they said, Don, you're going to understand one thing about Denver. People don't want you to use their photos. Well, within 6 months, he had about 50 before and after photos from doctors, lawyers, teachers, because of his technique. It's how he asked. Now, there's a story about Steve Jobs from Apple. He was at this big meeting one day, and the discussion was about those little, in fact, if you're old enough, when you had a computer, you had to play a CD-ROM, you had to press a button and a tray came out, and you put your CD in there and it sucked it back in. Well, cars at the time, and this was about 12 or 14 years ago, cars at the time had a front-loading CD. You could just put the CD in and listen to your music. So Steve Jobs says, look, if cars are doing it, I want to do it on a computer. And the board of Apple argued with him, and they said, we're not ready. It's very expensive to do this. And he interrupted by saying, look, here's the Wayne Gretzky quote. He said, we got to skate to where the puck is going, not where it is now. He says, where computers are going are front-loaded DVDs, not a tray. And he had that same philosophy and approach with eliminating the DVDs and CDs altogether. You know, Mac and Apple, they were the first to really embrace this technology, to be different, and they had to think differently about how they were doing it. Well, in dentistry, because of social media and because of the internet, and because of Google, people are Googling dentists now. You know, it's funny, 10 years ago, you looked in the phone book. It's just 10 years ago. 5 years ago, people were still looking in the phone book. 5 years ago, people were asking their friends, who's that dentist you go to? Now they don't ask their friends, they just ask Google. Dentist, who's a good dentist? Top dentist, whatever. So since where the puck is going is people are visiting more websites than ever before. So how do you differentiate yourself? With powerful photography. So I'm going, in the next few courses, we are going to give you proven techniques, strategies to get patient photos from half of the people that you ask for. Because the future of this is, look, if I met you 1 year ago, 52 weeks ago, you know, and I know, that there's at least one patient in a whole week that says, oh, I'm so glad I got this procedure. Oh, I feel so much better since you fixed my cracked tooth. I could eat so much better. Oh, that was so good. I should have done this years ago, right? And if you were able to get that patient's either video testimonial or a picture that you can share that story on Facebook or on one of the social media venues, then it's going to motivate other people to do it. You would have, if I met you a year ago, 52 photos of patients, befores and afters. So when they are in your office, because this is the point. So when they're in your office, you're doing a consultation. The doctor's doing a consultation. You case presenters are doing a consultation. And turns out, if you take enough of these photos, let's say you just had 52 before and afters, and I'm talking about their faces are in the photo, not just the retracted view. Because people have a tough time putting together, I like what that looks like. It doesn't. Look, my editors here at the Wellness Hour, when people show retracted views, they can't even eat meat or steak for a week. It's so gross. So you got to stop showing retracted photos to patients because it doesn't motivate them to do anything, right? They might like you and they're polite about it, but I wish you could read their mind because it's not a pretty sight. But could you imagine taking a patient and whether they had 2 front teeth that were gray or short teeth from where? You could pull up a screen from one of your like patients and you could say, look, here's a patient that had short, worn teeth. Look at the way they look after we put the veneers on or we put the crowns on. Look at the difference. They look younger, they look more attractive, they look more educated. It'll help put your presentation on steroids. These photos are important in every single thing you do, and it's what's going to differentiate your practice from the others.